Hello, this is Dr. Wells from Wells Medicine, and we've been getting a lot of interest in stellate ganglion blocks lately. And I thought that I would talk a little bit about what it is, how it works, and how long it lasts, and what patients can expect. So the stellate ganglion is named after a star-shaped, that's what stellate means, a star-shaped ganglion, which just means a bundle or bunch of nerves. And it is next to the carotid artery in this part of the neck, the front part of the neck. And that nerve is basically the sympathetic nervous system, all in one place. So the stellate ganglion is a bundle of those nerves of the sympathetic nervous system that you can block with a particular medication that blocks nerves. So people may have had a nerve block before when they went to the dentist. They may have had a nerve block for surgery before. Basically, anesthesiologists inject a medication that turns off the electrical signals that nerves use to transmit their information. So you might have heard of Novocaine or lidocaine. Any of those canes decrease the transmission of the nerve's electrical signals, and we use a special one of those called bupivacaine, which is very slow onset and slow offset medication to block the sympathetic nervous system for about 24 to 36 hours. Once that medication is in place, the sympathetic nervous system turns off, and then when it comes back online, it sort of reboots. So if you are suffering from symptoms of hypervigilance, PTSD with very physical symptoms, so racing heartbeat, sweating, constant checking, nervous energy, restlessness. A lot of patients will tell us that they've done all the therapy in the world and they can intellectualize their anxiety, or they can intellectualize their trauma, but they just haven't gotten rid of the physical symptoms. And that's where those patients are a really good candidate for a stellate ganglion block, because the sympathetic nervous system handles all of those very physical symptoms. So for patients who have read the book Your Body Keeps the Score, which is kind of the tome about PTSD and how it's kind of physically kept in the systems of the body, the stellate ganglion decreases the sympathetic nervous system and allows that reset to help patients go on about their lives without the hypervigilance and the physical symptoms. When this works for PTSD or anxiety, patients notice almost immediately. So sometimes even before they've left our office, they'll say, "Oh my gosh, there's quiet. It feels so different. I'm so relaxed. Oh, my head is just so quiet. I just don't feel that racing energy." And they'll notice that immediately, and generally that lasts between 3 to 6 months. So obviously it's better with more therapy. It's better starting to do yoga or exercise. It's better adding in magnesium and vitamin D. It's better changing your diet to a less processed diet. All of those things can help extend it. Meditation, journaling, obviously those as well. But usually we can get about 3 to 6 months out of a stellate ganglion block. When we start with stellate ganglion blocks, usually we do the right side first. 80% of patients who are going to respond to the right side. There is about a 20% response rate to the left side. So if the right side isn't that big boom response that we hope to see, usually we can get that then out of the left-sided stellate ganglion block. A lot of patients will ask, well, can't we just do both in the same day? I don't like doing that for 2 reasons. One, we really can't do that because part of the side effects of a stellate ganglion block that is working correctly are a difficulty swallowing and a little bit of a hoarse voice. And so to do that on both sides can actually be quite dangerous because it's a lot of difficulty swallowing and a very hoarse voice. And so we would never do both blocks on the same day, but you can do both blocks within a short period of time, say 2 or 3 days. But I actually like spreading them out for another reason, and that's because if you get that big boom change with the right side, then maybe we just need to continue doing the right side every 3 to 6 months. If you don't get that big change with just the right side, then it's a good effort to try the left side and see if that's the big change, or to see if there's just a little bit more juice out of that squeeze, and doing both sides is what's really helpful. Similarly, some people are right-handed, some people are left-handed, and there are some people that can kind of write with both. So we know that most people get that benefit out of the right, some people out of the left, and some people need both. And that actually has nothing to do with which hand you're dominant, but it's a good way to kind of relate to some people are right-handed, some people are left-handed, and some people do well with both. When the stellate ganglion block is working correctly, there are some effects that we expect to see that helps us know that it's working correctly. But they can be kind of discomforting for the patient if they don't expect them. So when that stellate ganglion block is working, we expect to see that side of the face be droopy. So the mouth can be a little droopy, the eye can be a little droopy, the eye can be red, the pupil on that side might be pinpoint, so they might notice a difference in vision between the two eyes. A lot of people will notice numbness on the side of the neck, a thickness to the throat or to swallowing, a hoarseness in their voice, sometimes a little bit of a funny feeling with turnover of the breath, sometimes a little weakness in the arm and shoulder. All of those things are expected effects and help us know that that block is working. Now, we don't take very long to do the block. It takes about 5 or so minutes to do the block. We do talk a little bit first because I'll go over some of those holistic and lifestyle changes before we do the block. And then afterwards, we ask patients sit with us for about a half hour as the block, what we anesthesiologists call it, sets up. So all of those effects start happening over about a half hour, because that medicine, again, works very slowly, but then works for a very long time. So by the half hour point after the block is done, all the changes that we would expect to see from the block have really started settling in and having their effects. So I don't want patients to get out to their cars, start driving, and then notice that their voice is thick. I don't want them to start noticing that their eye is drooping when they get into their car and check their rearview mirror. So we like them to sit with us about a half hour after the block is done. None of those effects, even though they can be uncomfortable, are dangerous. They're just things that we like to watch out for. Now, the block does have side effects that we watch out for that can be dangerous. So when you're working in the neck with any kind of needle or medication, it's a valuable real estate area. So this block has been done since the late 1800s just by feel. There's a little protuberance on the surface of the vertebrae that you can feel for, and then stick a needle in towards that protuberance, bump off the bone, come back just a half of a millimeter, and leave the medication there while you're pulling aside the carotid artery with your fingers. And this is what's considered a blind block. You really can't see what you're doing, but you can kind of feel it. That's how they started doing this block in the 1800s for indications that weren't PTSD. So they were doing it for claudication of the arm, for vasospasm of the arm, like a Raynaud syndrome. They were doing it for complex regional pain syndrome of the upper extremity. They were doing it for hyperhidrosis or heavy sweating. So you are able to do it without an ultrasound, but there are so many things going on in this area. After they developed X-ray, they started doing this block with X-ray. And then once we developed ultrasound and could see the nerves, we can see the great vessels in the neck, like the carotid artery, the internal jugular. It's so safe now with ultrasound because you can really see what you're trying to avoid, and you can see where you really want to put the medication. So there are some side effects of a block that are very rare. Things like reactions to the medication, seizures, damage to nerves, artery, vessels, bleeding, paralysis. But those, because of the ultrasound and being able to visualize things so carefully, those are actually very, very rare. The block, when it works, is very quick. to set up, very fast to see the benefits, and we really only need to do it every 3 to 6 months. In summary, for PTSD, the stellate ganglion block is a very safe and very effective treatment that works very quickly.